Hi, this is Haylee Thompson for my head to toe assessment, and here's my rubric. Okay. And I think I have everything. And hydrated. Hello, my name is Haylee. I'm going to be your student nurse from SVSU doing your head to toe today. That's okay?
Yes.
Can I start with your name and date of birth?
Emma Stemke, 6/16/03.
Perfect. And can you tell me where we are right now?
Saginaw, Michigan.
Perfect. So I'm going to start with a brief health history before we get started on your head to toe. So do you have any medical diagnoses or anything like that? Any past surgeries? Do you take any medications?
No.
Okay. Feeling pretty healthy today. Are you experiencing any pain?
No.
Okay. And do you smoke or drink at all?
No.
And any allergies?
No.
Okay, perfect. Pretty healthy. So I'm going to start off with some vitals, and then we'll start on your head to toe. So I'm going to do blood pressure first. Do you have a preference which arm? I'll start over here.
I'm going to roll this up real quick.
Thanks. I'm going to have you flip your arm that way. Okay. Thank you. And then I'll put this up here. You can let that down if you need to. Okay. Alright, your blood pressure was 110/74 today, so that was super healthy. And then I'll do pulse on you. Okay, and your pulse was 62 and your respirations were 14, so those are perfect within range. I do not have a thermometer, so I will not be able to take your temperature today, but if I did have one, I expect your temperature to be about 98.6 in that range. And I also don't have a pulse oximeter with me, but I will check your fingers instead for oxygenation. I don't see any signs of cyanosis or anything. Your capillary refill is less than 3 seconds, so that is good today. So your oxygenation is good. And then, so your vitals are done, did health history, so I'm going to start with your arms. Okay, so I'm going to roll this up for you real quick, if that's okay. Okay, so first I'm going to inspect your arms, and everything looks good there. Don't see any cyanosis or lumps or bumps or anything. Good pigmentation. So I'm going to feel temperature feels nice and even. Good. Good temperature, nice and warm. Feel for muscle tone. Feels nice and symmetrical, nice and strong. And then can I have you rotate your wrists like that? Okay, good. Crack. Is that pretty normal to crack like that? Okay. And then I'm gonna have you swim with this arm. Good. Okay, good range of motion there. We do the same thing over here. Okay. Good cracking over there. Is that pretty normal? Okay. So your range of motion looks good. And then I'm gonna have you go like this, and I'm gonna check your symmetry of your pulses. So that's nice and good. Your radial pulses are nice and symmetrical, and then your brachial pulses, those are nice and symmetrical as well. So your arms look good to me today. And then so I'm going to start from your head and work down to your toes. So first I'm going to inspect your hair. I don't see any abnormalities, no critters or creepy crawlies or anything. I don't see any dryness, so I'm going to feel your hair. Feels nice and good. No excessive dryness or excessive greasiness or anything. Okay. Everything looks good here. And then I'm going to feel the back of your head as well. Don't feel anything bad back here. And then while I'm here, I'm going to do your lymph nodes. So these are your occipital lymph nodes. And here are your pre and post irregular lymph nodes. Those feel good. We got your submandibular. Those feel good. Your submental. That's no swelling or tenderness. Do you have any pain there at all? Okay. And then your cervical chain. And then your supraclavicular is here. So your lymph nodes all feel good. No tenderness, no swelling or anything. I'm going to feel for your tissue trigger to test your hydration. And that is nice and good. No tenting there, so that looks good. I'm going to go back up and check your ears. So your ears look nice and good. I don't see any abnormalities. Are you tolerating those piercings pretty well? Okay. I'm just going to pull. Okay. Nice and good there. And then go over here. This one looks good as well. I don't see anything like too dry or anything like that. I'm gonna pull. Is this piercing good as well? Mm-hmm. Okay. And your ears look good today. Now I'm gonna go to your face. To your face and like your eyes and stuff. So I'm gonna inspect your skin first. Everything looks good. Good pigmentation. Don't see any excessive dryness or anything like that. I'm gonna start by palpating your sinuses. Do you have any pain here at all?
No.
Okay, so these are your maxillary sinuses, and then your frontal sinuses. Don't feel any swelling or anything like that, and you're not experiencing any pain, so good there. And then I'm gonna go to your eyes. I'm gonna pull up and have you look down, and then I'll pull down and have you look up, and then same thing over here. Okay, so your sclera looks good, nice and white. The mucous membranes of your eyes look nice and pink, so no dehydration. And then, so next I'm gonna shine my light in your eyes, but don't look directly at the light, but somewhere in the background. So I'm gonna put my hand in the middle and test your symmetry of your pupils. Okay, so it looks good. And then I'm going to have you look at my pen light, and then look at my hand, and that's pen light, and then my hand. Okay, so your pupils were nice and accommodating. They were equal around reacting to light, and then they were accommodating to the distance, so those look good there. And then while I have my light out, I'm going to test your cerebellar function. So I'm going to have you, I gotta test one more thing with your eyes real quick. So just follow the pen light with your eyes. Okay, so your cranial nerves 3, 4, and 6 were good. They seem intact, so you were able to follow this light, so we are good there. And then, so I'm here to do your cerebellar function now, and I'm going to have you touch your nose and then the pen light, and then I'll move the pen light around. Okay, got there, and then, so that was one of the 3 tests, and can I have you make an okay sign with both your hands, and then switch, tap your fingers, and do that as fast as you can. Okay, perfect, and then I'm gonna have you put your hands on your lap, flip them over, and then do that as fast as you can. Okay, so all 3 of those tests for cerebellar function were good, so coordination is nice and good today. And then now I'm going to go to your nose. So I'm going to have you close your eyes, and I'm going to test your cranial nerve 1, which is your sense of smell. So I'll put this around your nose and have you tell me what you smell.
Coffee.
Perfect. Nice and strong smell. Okay, so cranial nerve 1 is intact. Also with your eyes, I don't have the Snellen chart to test your cranial nerve 2, but do you wear glasses or contacts or anything?
Yeah.
Do you have them in today?
No.
Okay. Do you see pretty well, like decently without them?
Yeah.
Okay. So based on that, I don't have the chart, but I would say your cranial nerve is intact. Your cranial nerve 2 is intact. Okay, and then, so I did your eyes, I did the smell, so cranial nerve 1 was good. And then I'm going to have you tilt your head back, and I'm going to look at your nose. Okay, I don't see any perforations or any polyps or anything. Your nasal septum looks good, so that's good. The outside of your nose looks nice and good. I don't see any piercings or anything. And then, so now I'll look in your mouth. So your lips look nice and dry and stuff, so I'm gonna have you open your mouth. Okay, so I don't see any lesions or sores or any dental caries, so that looks good. And then I will have you open your mouth and say ah. Okay, perfect. And then can I have you stick out your tongue and then move it side to side? Perfect. So your cranial nerves 9, 10, and 12 are intact today, so those are good. And then real quick, I'm going to have you close your eyes, and I'm gonna put this on your face in different places and have you tell me where you feel it.
Chin. Cheek. Forehead. Cheek. Nose.
Okay, perfect. And then real quick, I'm gonna test your shoulders for your accessory muscles. I'm gonna have you shrug your shoulders up and down. Perfect. So your cranial nerve 11 is also intact, and then we just did your 9, 10, and 12 with your tongue. So those were good too. So we did your mouth, I did your face. Next I will go to your neck. So first I'm gonna inspect your neck. I don't see any abnormalities, any lesions or bumps or different colors or anything, so that looks good. And then I'm gonna feel for your alignment of your trachea and your thyroid. And that seems nice and symmetrical there, so that feels good. No lumps or bumps. Then we go to your carotid arteries, so I'm gonna feel up here, one at a time. Okay, so I'm gonna feel first over here. And it's a nice strong beat. I'm gonna feel over here. And that is also nice and strong, so I'm gonna listen with the bell of my stethoscope. I'm gonna have you hold my breath when I touch my stethoscope too, so I can just listen to hear any sounds there. Okay. Alright. Okay, and I don't hear any bruise, any swishing sounds there, so that is good. Those are nice and healthy today. And then, in just a minute, I'm going to have you turn around. Before I have you turn around, I'm going to check my sheet and just make sure I have everything on the front that I have so far. range of motion, your pulses, cat refill. Your face is nice and good. Oh, I have to do your cranial nerves 5 and 7 real quick. So I'm gonna feel your jaw muscle. Can I have you bite down for me? Okay, that was nice and strong. And then I felt for your where you felt that. So that was your cranial nerve 5. So 5 is intact. And then can I have you smile for me and frown? And then can I have you puff out your cheeks? Okay, so cranial nerve 7 is intact as well. So we tested 1, 2, 3, 4, 5, 6, 7. So those are good. And then we also did 9, 10, and 12, and then I checked 11. So we're good there. And then 8 will be later at the end of the head to toe assessment. So now I'm gonna have you, can I have you turn around in the bed? Perfect. And you're okay having this open?
Yes.
Okay. So first I'm going to feel your trachea and your thyroid and just make sure that's all good. So I don't feel anything bad here. It's all nice and symmetrical, no any nodules or anything. So I'm gonna push over and have you swallow. And push the other way, have you swallow again. Okay, that is nice and good there. So now I'm gonna do your lung assessment. Move your hair all the way for me. First, I'm going to inspect your back and your spine. So, skin looks nice and good. I don't see any, just hair here real quick, sorry. I don't see any discolorations or anything, just some healing sunburns. So it looks good. Your spine looks like it's nice and straight. And then, so I'm gonna feel and have you do a big deep breath for me. And your chest expansion was nice and good there, nice and symmetrical. So now I'm going to listen to your lung sounds with my stethoscope. And then each time I touch my stethoscope to your back, I'm gonna have you take a deep breath for me. But we'll go nice and slow so that you don't lose your breath or anything like that. Okay. Okay, so first I'm gonna feel up here at the top. And then I feel your scapula here and your spine in the middle. So I'm going to start with my first lung sound here. All right, and that first one was good. Moving on to the second. Okay, second was good. Third was nice and clear. Moving to the fourth. Fourth was clear. Moving to fifth. And fifth was clear, so we're going to do one more on each side. Alright, and all 6 spots on each side of your lungs were nice and clear. So those are good, and now I'm going to percuss your lungs, and I'm going to listen for resonance. Your first and second sounds on each side have been resonant so far. Here's your third set. Third was good. Moving to fourth. Fifth. And sixth. Okay, so all those sounds were nice and resonant, so those are good to me today. Lungs are nice and healthy, and your skin looks good back here. And so now I'm going to have you flip back over and you can lay down. So first I'm going to take this pillow away for just a second, and then I'm going to look at your neck again. I'm going to have you turn your head towards the wall for me. Okay, so your neck looks good. I don't see any signs of jugular venous distension or JVD, so that looks good there. I'm going to have you turn your head towards me, and looks good on that side as well. No JVD over there. And you can lift your head up, I'll give you this pillow back. Okay, and then so I'm gonna do your cardiac assessment, but can I have you take off like the arms if you're comfortable with that? Okay, so I'm gonna hand the camera to you. So we got your left and right sides of each other body. Okay, so inspecting your chest first. Inspection looks good, your skin's nice and intact. I don't see any abnormalities or anything, so I'm gonna start with, I'd say your cardiac assessment is safe to start. So I'm going to feel all 5 of your cardiac valves, and I will tell you what rib spaces I'm at, and then I'm gonna listen with the diaphragm of my stethoscope for the normal lub dub S1, S2 sounds, and then I'll flip it over to the bell to listen for murmurs. Oh my goodness, my stomach is making all kinds of noises. Okay, so we're gonna start with your aortic. So here's your clavicle, first rib, first space, second rib, second space. I'm placing my diaphragm here. And that was normal lub dub, flipping over for my bell. And I don't hear any murmurs there, so that is nice and good. So your aortic is healthy. When I go to the left side, your second rib space for your pulmonic valve. So here's your clavicle, first rib, first space, second rib, second space, and put my diaphragm here. And I hear normal lub dub sounds there, flipping over to my bell. And normal sounds there as well, no murmurs. So I'm gonna go down to your third valve for your Erb's point, and that is your third rib space, so I'll listen there as well. Okay, so you have your first rib, first space, second rib, second space, third rib, and your third space is here. So here's your diaphragm. And normal heart sounds there, flipping over to my bell. And no murmurs there, so that is nice and healthy. Next, I'm gonna go to your fourth rib space for your tricuspid valve. So here is your clavicle, first rib, first space, second rib, second space, third rib, third space, fourth rib. I'm gonna meet under your fourth space. Come under here. Sorry. Okay, so there's your normal lub dub sounds there, flipping over to my bell. Go under here again. And no murmurs there, so nice and healthy. Now I have one more valve. I'm gonna do your mitral valve on your fifth rib space mid-clavicular, so I'm gonna go down there. Okay, so your first rib, first space, second rib, second space, third rib, third space, fourth, meeting under here, fourth space, fifth rib, fifth space, and we're gonna go mid-clavicular over here. Okay, so that is a nice healthy heart sound there. And flipping over to my bell, sorry, I might come up here again. And I don't hear any murmurs there. And I'm gonna flip back over to my diaphragm. I'm gonna listen here for your apical heart rate for a full minute. Alright, and your apical heart rate was 62, so that is nice and good. So your cardiac assessment was good. I'm going to move to your abdominal assessment. I'm just going to pull this down a little bit, if that's okay. Let's start just a little. Okay, so I'm going to listen. I'm going to inspect first, and then I'm going to listen, and then I'm going to percuss, and then palpate. So first, inspecting your abdomen. I don't see any abnormalities. I don't see any. I see your aorta pulsing. I don't see any distension or anything, so it looks safe to start on the assessment. So I'm going to listen to each of the bowel sounds, each of the quadrants of your bowel for normal bowel sounds. Okay, so listening with my diaphragm, starting in the lower right quadrant. And 5 bowel sounds there, going to the upper right quadrant. Normal, 5 normal bowel sounds there, going to upper left. And normal bowel sounds there, going to lower left. And normal bowel sounds there as well. And then I'm going to use the bell of my stethoscope to listen to your major arteries. So I'm going to start them up here, probably about here. So we're going to go here for your aortic, or for your aorta. I don't hear any bruits there. Going to your right renal. And left renal. And no bruise there, going to your right iliac, or your left iliac, and right iliac. Alright, and those bowel sounds are nice and normal, and your sounds of your artery, I didn't hear any bruise or any sounds in your arteries, so that is nice and good today. So now I'm going to move to percussion in each of the quadrants to listen for tympani. So I'm going to listen in your lower right quadrant, upper right, upper left, and lower left. So though I heard tympani in all of those, so now I'm going to start at the top of your lower right and work up to your liver border. Okay, so I heard tympani all the way up, and then I heard dull at your liver border, so that was nice and good. And then now I'm going to move to palpation. So I'm going to start with some light palpation in the lower right. Do you have any pain or anything here?
No.
Okay. And then the upper right. Okay, upper left. And lower left. Okay, so that was nice and healthy, so I'm going to go a little bit deeper now. Any pain at all?
No.
Okay. And that was the lower right, upper right. It's nice and healthy. Upper left. And lower left. Alright, so that was good today. So your abdominal assessment was good. And then while I have you here, I'm going to do your femoral arteries real quick. So it's okay if I just pull this down just a little bit. And then I'm going to have you lift up. Actually, I'm going to pull this up and have you put it on your arms. I can hold this real quickly and put it on your arms. Okay, and then I'll go pull it up so I can get your legs. And then, so I'm going to have you lift one of your legs. And I'm going to feel here for your femoral artery. I'm going to pull your shorts down just a little bit, sorry. Okay, and that's a nice and strong pulse there. And then I'm going to feel on this one. Thank you. Alright, and that one's good there. And then I'm going to have you put both your legs up real quick, just for a minute. And I'm going to feel for symmetry. Sorry. Okay, those are nice and symmetrical. And then I'm going to listen to them one at a time with the bell of my stethoscope to listen for any bruise. Okay. All right, and no burpees there. I'm gonna do the other one. And no burpees there as well. So femoral arteries were good. Your cardiac assessment, abdominal assessment, and femorals were good as well. So I'm gonna put the camera back and we can do your legs real quick. But I'm gonna check my paper real quick and make sure I have everything that I need to so far. Okay, so I did your lungs, did your chest, cardiac, abdomen, and femorals. So good there. And then we're gonna do your legs real quick. So first I'm going to inspect your legs. I don't see any excessive dryness or any abnormal pigmentation. Looks nice and good pinkish color. So that is good. And then I'm gonna start by feeling the temperature of your legs. And that is nice and symmetrical, nice and even. So that's good there. But feel for your muscle tone. Okay, nice and good, nice and symmetrical, good strong muscles. So now I'm going to, so I felt the temperature. I'm gonna use this tool and I'm going to have you close your eyes, and this will be a sharp sensation and this will be a dull sensation. Okay, so I'm gonna just have you tell me which one you feel and where you feel it.
Sharp on my shin. Sharp on the other side. Dull on the thigh. Dull on the other thigh. Sharp on my knee. Dull on the other knee.
Okay, so your leg sensation is good there. Point localization is correct as well. And then, so I'm going to do the pulses of your legs real quick. Here is your popliteal pulses. Those are nice and symmetrical. Your I'm gonna pull this a little closer. Dorsal pedis. These pulses are symmetrical on the inside of your ankles, and then, or that was your post-tibial pulse, sorry. So those are nice and symmetrical. And then your dorsal pedis pulses, and those are good and symmetrical as well. So it's good there. Your feet look nice and good, no cyanosis or anything. Skin looks nice and good and intact. So your leg assessment looks good today. And then I'm gonna have you sit up for me. And then test the range of motion of your legs real quick. So can I have you move your ankles a little bit? Okay, good. And then try to do the same thing with your legs if you can. Okay, good there. Range of motion is good in your legs. So that should be all good today. I'm gonna test your patellar reflex real quick before you just stand up. Do they normally have like a good okay, so I'll try my best here. But oh, got a little in there. And over here. Okay, I'm gonna try one more time. Okay, I see a little bit of movement, but not much there. So, but that's normal for you, as you said. So I'm gonna hand you the shoes. I can help you tie them if you need. I'm gonna check my paper one last time while you're getting those on. So got your pulses. I didn't see any edema in your legs. And you got, okay, we're good there. And then, okay, so your shoes are on. Once you get stood up, I can tie this for you if you want. Okay, so I'm gonna have you stand up for me and have you stand here with your eyes closed for 10 seconds. And I'm just gonna test if you sway at all. Okay, good. You did not have a positive round break, so that's good. So we're good to test your gait real quick. I'm just gonna tie this up for you so we don't fly open. Okay, and then move the camera so we can test your walking. Okay, so maybe walk towards the closet, just normal. Okay, and walk back. Okay, and then do the same thing but heel to toe. so your cranial nerve 8 is intact as well today. So your head to toe looks nice and good. You're a good, strong, healthy person today. So real quick, I'm gonna do your brain scale for you. So your sensory perception seems pretty good. Your activity and mobility are good. You have good like diet and exercise. So I'm not worried about nutrition. Not worried about moisture, incontinence, or anything like that. And then since you have good activity and mobility, I don't see any issues with friction and shear. So your brain scale score today is going to be a 23, which is the best you can get. So nice and healthy today, past your head to toe. So, all right, thank you for being my patient today.